to where we started, which is getting people better. So I spent a lot of my time, introducing technologies and applications that, might be new to some people, but also on the integration side of things. And I always like to tell a few stories, but how do we know it works? How do we know it doesn't work? So using evidence-based practice is a really good first step, is finding out what the best literature is out there, but also knowing that it changes. So I use this example. I was giving a seminar and we were talking about decompression and on low coefficient friction design tables. Um, it's not the same as like where a lot of this started back 20, 30, 40, 50 years ago. Actually, decompression or mechanical spinal traction dates back some 4,000 years. So it goes way, way back. And, the technology has changed as such where, I don't need to use 50% of body weight anymore. And I had a attendee come up to me at one of the breaks and she says, just because you say it, it doesn't mean that I'm going to stop doing it because that's how I do it on this particular platform, which was actually the one I was talking about. And that's fine. The cool thing is that, if you're getting the outcomes, and that's one of the factors, one of the KPIs, key performance indicators that you want to consider within your clinic setting. And that'll be my first kind of pitch to say, you got to collect data because we want to know that whatever it is that we're doing is working and what doesn't work, because it's certainly about the patient satisfaction.